Lips. How much art, how much science to the lips with augmentation?
Lips are 95% artistic, 5% technicality. How's that? I love doing lips, Randy. And I do them a little bit differently than most people do. I don't stick a needle into lips because I don't like to create bruising and swelling. The lips are delicate structures. When you stick a needle into a lip, it's going to bleed and it's going to swell.
But isn't that how it's done everywhere?
Most
of the time?
vast majority of the people do it that way.
Well, how else do you do it?
Tell you what I do. I just make a little, inject a little bit of local anesthesia at the corners of the mouth, and then I take a small needle, place it in there, and then take it out after a minute, and then I take a cannula. And the cannula is essentially a long, thin tube that instead of having a needle at the end of it, it's blunt.
Okay.
And the product comes out the side as opposed to coming out the tip.
So you just kind of layer it in with the...
What you do is you go right into the lip, and what you do is you gently inject as you come out.
You get better results that way?
It is incredible. You can actually watch the lip fill naturally. And with that cannula, I can put it anywhere I want. I can...
Sounds painful.
It isn't though, because I do a dental block before I actually do the
So that's
procedure.
your advantage then, being, having a medical doctor do it over an RN?
Yeah. A lot of RNs and people like that won't do the dental blocks. They don't want to have anything to do with it.
So no pain at all?
Yeah, but with my situation where I do the dental blocks, I will tell you that patients that have had it done without a block and patients that have had it done with a block, I would say about 80 to 85% of the patients say that it was drastically better.
So natural lips, or you like the big lips?
No. Natural is really important. If there's one thing I think that God did when he created the human face is that he made the lips one of the most beautiful structures on the human face. When we fill that too much, Randy, we turn a beautiful lip into a Jimmy Dean sausage, and you might as well just throw it on the fryer and have
Do
it.
women think that looks good, by the way? Because
breakfast.
no guy that I've ever met thinks that looks good.
I think if a woman...
Or the surgeons look... I mean, who thinks it looks good?
If a woman or another person thinks that an overinflated lip, where the normal anatomy of the lip has been bastardized and turned into like this sausage deformity, which is what I call it, I think those patients unfortunately have a distorted view. The worst
Do you talk people out of it?
Oh, I will definitely talk people out of it. I've had patients come into my practice, Randy, that have huge lips, and I'll sit there and I'll say, ma'am, please don't take this as being disrespectful, but I hope you're not here for your lips.
Wow.
I will say that because
Do they ever say yes?
Yes, they will. And I'll say, why do you think you need to have bigger lips? And, my boyfriend likes it.
So natural looking lips. I mean, that's the takeaway here?
You have to. You have to. I mean, natural looking lips are, what I like to do is I like to give them a little bit of a vermilion border so that when they put their lip liner on, it looks good. Also, by doing the vermilion border, Randy, you prevent bleeding of the lipstick lines.
Okay.
I like to plump their tubercles a little bit, which gives them volume. And I'll even inject a little bit on the inside of the lip to get a little bit of eversion. But when they're finished, they love it because they know it's natural. And, the first thing I see when they look in the mirror, the first thing out of their mouths are, wow.